Your doctors still aren't working together. Hey folks, I'm Dr. Jeff Williams with Creekstone right here in Amarillo, Texas, and I want to talk to you about some new information that's showing that we can do a better job with back pain than we've been doing here in the United States. And then I'm going to show you how we will be doing our part here at Creekstone to improve that. I hope you'll take just a second to hit the subscribe button right now if you're watching on YouTube, and maybe the like and share buttons on Facebook so that we can tell everybody the really good news I'm going to be sharing towards the end of the video. There is new research showing that primary care providers or family doctors are still slow to adopt new recommendations for treating low back pain. The days of your doctors actually working together are coming, but to be blunt, those days are taking their sweet time to get here because it's not happening right now. In 2017, just 4 years ago, the American College of Physicians, they shook the medical and the pharmaceutical worlds to their core when they updated their guidelines for the treatment of acute and chronic back pain. Basically, one of the largest organizations in American medicine, the American College of Physicians, told physicians that the best first-line options for acute low back pain are as follows. They should select non-pharmacologic treatment first: spinal manipulative therapy, heat, massage, acupuncture. Or, if pharmacologic treatment is desired, clinicians and patients should select non-steroidal anti-inflammatory drugs or skeletal muscle relaxants, or muscle relaxers is what we call them. So all of these, spinal manipulative therapy, that's, chiropractors. We'll get to all this though. Those are grade 1 strong recommendations according to the American College of Physicians. Acute pain is pain that has lasted less than 3 months for the most part. Again, acute pain less than 3 months in duration. Now, the American College of Physicians did not stop there. They included recommendations for treating chronic back pain as well. Their first-line treatment recommendations for chronic back pain are as follows. Again, the patient should initially go with non-pharmacologic treatment with exercise, spinal manipulation, multidisciplinary rehabilitation, acupuncture, mindful-based stress reduction, Tai Chi, yoga, motor control exercise, progressive relaxation, electromyography biofeedback. I'm not going to lie, I don't know what that is. Low-level laser therapy, which we have. Cognitive behavioral therapy is the last one. And once again, these are grade 1 strong recommendations coming from the American College of Physicians. Now, chronic pain is defined differently by different entities and organizations. Some say chronic pain is pain that lasts 3 months or more. We don't have very long to hurt, do we, before it starts to turn chronic? So yeah, again, chronic pain, some say 3 months or more. The National Pain Strategy defines chronic pain as pain that is experienced at least every other day for 6 months or more. Either way, I explain it to my patients as pain that is long-lasting or lingering. People usually can understand that pretty easily. If a person is astute and really pays attention to these recommendations, well, they require a combination of providers and practitioners to provide all of, or at least some of, these recommended treatments. This is referred to as a multimodal approach, coming from all different directions, several different therapies from several different providers typically. For example, a medical provider can provide non-steroidal anti-inflammatory drugs or skeletal muscle relaxants. But neuromusculoskeletal pain is not typically a medical provider's specialty. Research is clear that providers cannot be expected to know everything about everything. This is why we have different types of providers and specialists. Beyond the pharmaceutical aspect of treatment, chiropractors offer the spinal manipulative therapy. Some chiropractors offer acupuncture, heat. Some do a lot of soft tissue massage work type treatments. Chiropractors and physical therapists both offer very targeted and specific exercise recommendations. So as you can probably sense, a trip to a medical provider alone is not typically going to take care of back pain. at least not as comprehensively as a trip to a healthcare provider could take care of it. In addition, there's new research that shows very clearly that medical providers are not typically adhering to the American College of Physicians guidelines, just as we discussed. 4 years after the American College of Physicians recommendations came out, the researchers interviewed 72 primary care providers from 3 community-based outpatient clinics about their familiarity with these guidelines and how they initially manage patients with acute and chronic low back pain. And they were also asked about their comfort level in referring patients to non-pharmacologic treatment providers. Well, it turns out that a little over 3/4 of the providers were familiar with the guidelines, but for acute back pain, the primary care providers were still just telling patients, stay active, and then giving them non-steroidal anti-inflammatories, rather than following the guidelines more thoroughly. For chronic back pain, the primary care providers were more likely to recommend non-pharmacologic treatments, which was nice to hear. The researchers summed it up by saying, while most primary care providers indicated they were familiar with the American College of Physicians guidelines for low back pain, non-pharmacologic treatments were not recommended for patients with acute symptoms. Further dissemination and implementation of the guidelines are needed. So what they mean there, when they say all that, is that primary care providers could become more familiar with the new ways of treating back pain. As we'll talk in just a minute, chiropractors saw, in this research paper, chiropractors saw about 21% of the primary care referrals. That's not very many. For evidence-based, patient-centered, and specialized chiropractors, 21% of the referrals, that's just a starting point, but it must be improved on. Here at Creekstone, well over 74% of our patients report that their conditions have resolved at the 30-day mark. Can you imagine the impact we could make if we saw more of those suffering from back pains? More than 21%, right? Now, my last point on this brand new research is that of the non-pharmacologic treatments recommended, the most common was physical therapy referrals at 78%. Again, as mentioned, chiropractic saw only 21%, massage therapy saw 18%, and acupuncture 17%. What if, however, here's the good news, what if all of these providers were in one place? What if all of this recommended care were under one roof in a truly integrated setting? Well, now they are. Creekstone Integrated Care has hired a medical director, a physician, a medical doctor. We have hired an advanced nurse practitioner, and we are bringing medical services into our clinic. We are rebranding to Creekstone Integrated Medical, and we'll now have providers of all kinds: medical, chiropractic, exercise rehab, massage, and acupuncture, all under one roof for easy access and comprehensive care. Creekstone Integrated Medical is now your one-stop healthcare clinic for everything just short of surgery. Spread the good news, y'all, because something special is about to happen for those in our community and in our area that are suffering from pain and disability. You now have a place to come to that understands the most recent treatment guidelines and can offer a truly integrated and multimodal approach to knocking out your pain. Now, if you're watching this on YouTube, y'all, please take a second to subscribe, comment, and share. If you're watching on Facebook, like, comment, and share. That's how the world goes around in these days of social media. If you're from the Amarillo area or you're going to be traveling through and you need to be seen by any of our providers, just call 806-355-3000 and let's get you on the schedule. Let's get you to feeling better. Again, I'm Dr. Jeff Williams, and we'll see you next week.